it's a panel discussion going to be moderated by Dr. Swetha ma'am, and the discussion would be about challenges faced by AYUSH Hospital. So over to you, ma'am, Dr. Swetha ma'am, for moderating the session with the other panelists.
Thank you, Devashri ma'am. Thank you. So we have two panelists other than the speakers who are also joining in as the panelists. I'll introduce it's my pleasure to introduce Dr. Sanjeev K. Singh. Sir is a medical director of AIMS Faridabad and chief medical superintendent at AIMS Cochin. A pediatrician by training, has worked as a regional coordinator at WHO India in the disease eradication program before joining Amrita Institute of Medical Sciences. He is an improvement advisor at Institute of Healthcare Improvement, US. He is also an ambassador for India to Society of Healthcare Epidemiology of America and has been adjured as the hero of infection control by Association of Professionals of Infection Control, US. He is the international surveyor of ISQA. He was responsible for drafting accreditation standards for 3 and 4th edition at NABH. He is presently the vice chairman and the research committee at NABH. He is the chairman of technical committee AHPI and Health Sector Council of India. He is member of Drug Safety Council and member of National Advisory Board on Occupational Exposure. He is also a member of Healthcare Committee at Federation of Indian Chambers of Commerce of India and Secretary of AHPI Delhi NCR. He is an external consultant to WHO on regulatory licensing policy issues and quality interventions in India. He is a technical advisor to several state government healthcare projects such as e-learning, reduction of IMR, antibiotic stewardship, and infection control, and technical expert for University at US on neonatal collaboration program. I welcome you, sir. It is our pleasure to have you for today's panel discussion. Then we have Mr. Thaomunglung Chukhrungfa, who is a CEO at Kolkata, West Bengal, leading a transformation of a non-profit wellness project into a self-sustained center of excellence in integrative medicine. Sir, Tao sir has headed as a COO in formerly known as Guwahati Neurological Research Center. He has also headed a lead role in Office of Patients Experience from Birla Hospitals, Head of Support Services in Max Healthcare, and Manager Front Office in Rockland Hospitals. Welcome, Tao sir. We are looking for a very enriching panel discussion session along with all our other speakers. That is Dr. Rejikumar sir, coming from the homeopathy background, as he already presented regarding the homeopathy. Dr. Jyoti Nair and Mr. Rajan sir, who spoke about the statutory. Welcome all of you for the panel discussion. What is the basic requirement for an HCO to qualify for the NABH accreditation or certification program? Rajan sir, if you can help us answering this to the audience.
Thank you, Dr. Swetha. No issues. First of all, the organization I'm talking about, the basic requirement should have a registration with the local government body. If it is a panchayat, municipality. Then after that, depending upon your strength of the hospital and strength of manpower, strength of your size of the hospital, then it varies. So if it is, let's say, a 10-bedded facility, you will have minimum people. So ESI may not be applicable, PF may not be applicable, and the building will not be so big that you need a fire NOC. but definitely there will be effluence. So you need to have a clearance from the Pollution Control Board, PCB. So number one is registration. Number two is the PCB clearance. Number three, to go for NABH, you definitely should have a biomedical waste disposal system. With that, there should be a facility. There will be a third-party biomedical waste management program, third-party what you call institutes or common biomedical waste treatment plants. You can have an agreement with them, incorporate that with your pollution control board certificate. So these things, three things are mandatory with the NABH. If there is fire NOC is not required, then you need to have a third party what you call fire surveillance certificate from the third party fire audit team. So there are recognized registered fire audit people who will audit your fire service available, instruct you or give you instruction on installing more fire equipments related things, have it done, then again obtain a certificate from them. Then these are the things, basic things required when you talk about the statutory part of it. Okay. Now, then you should have electricity supply, and that accordingly, if you have lift, you need to have a license, lift license. Okay. If you, depending upon the state, if there is a pharmacy license required, you need to have pharmacy license. Depending upon the state requirement, if you need to be registered under Clinical Establishment Act, please register that. Depending upon the state, if there is a DHS registration or a DMO registration, kindly have it done. So these are all depending upon the state to set, but these 3-4 things are minimum requirement, and naturally NABH complying with NABH standards and that quality movement naturally will be different altogether. Everyone opened more about that, what is required in India committees, then all those aspects. Okay, I think Dr. Swetha, that should be fine right now.
Thank you for the detailed answer, sir. Along with this, a small addition that I would want to do is having your policies, your manuals, your SOPs, and implementing them for 3 months. This is also one of the basic requirement along with the statutory as explained by sir. So, taking on to the next question. Is there a difference in the requirement and the process of accreditation for an outpatient facility and that of an inpatient facility? So, someone wants to know if there is a difference in requirements, if it is a OP facility or an IP facility in terms of the standard requirements in the standards and the statutory requirements. Reggie sir, would you like to explain, because you were talking about the entry level, and so I think that answers more on these lines. So if you can help brief on.
Yes, I'm happy to explain that, Dr. Swetha. Actually, any institution can go for entry level like certification or accreditation. Only difference is whether they are outpatient facility or inpatient facility. Now, for outpatient facility, right now you can go only for certification like entry level certification. Now, if you are inpatient, you have two options. That is either entry level certification or full accreditation. So if you're having only like less than 10 beds, it will be better to go for the entry level certification because that's the only option. Now, if you have more than 10 beds, you can very well go for entry level certification as well as full accreditation. So it depends on whether you are having OPD, IPD, and under IPD, whether what is the size of your hospital, whether you are having a small healthcare organization or a large healthcare organization, depending on your beds. I hope it's clarified.
Thank you, sir. Hope that answers the question. We have one more question. As is a digital record maintaining must for the accreditation process? Dr. Jyoti, if you can help answer this question for us, for the viewers. I think Dr. Jyoti is not available. Reggie sir, if you can help us in answering this question.
Could you please repeat the question?
Yeah, so it says, is a digital record maintaining must for the accreditation process, or there can be manual as well?
Good. I understand. So, see, regarding, we were explaining the information management system, the IMS chapter of the NABH standards, which invariably states that there should be some method of data collection, data documentation, and data retrieval. So, with respect to the patient documentation, you should have a system for data collection, whether it is through your case taking or whether it can be online, offline, digital, non-digital, no issue. But that platform should be there and that should permit data retrieval. So it's not mandatory that you should have EHR always, like electronic health records. But if you have EHR, your data retrieval as well as your data analysis will be easy. So you can go for an EHR, or nowadays under the Ayushman Bharat scheme, we have the ABHA, which is the Ayushman Bharat health account. Every individual will be uniquely linked to a health record. So that can be shared between hospitals also. But for the time being, it's not mandatory to have a digital system. If you have a digital system, well and good. That is clarified.
Thank you, sir. Thanks for the detailed answer. So we have one more question here which asks about, can a small facility go for accreditation? Will it be affordable? So somebody wants to know whether it is affordable for a small setup or a small clinic to go for a accreditation process. Tao sir, you've been leading hospitals and facilities, clinics for the process. So could you help us in understanding and answering this question, sir?
Yeah, good evening, everyone. Am I audible?
Yes, sir.
Yeah. So to answer this question, affordability on the quality journey, that is NABH to the context today. So I would say center like us, Nature Cure and Yuva Center, which is situated in the city of Kolkata, can afford for going for the NABH accreditation. Everyone can. So if you really count on the monthly expenditure on the quality budget in towards NABH accreditation, it could be less than 10,000. So if you count from the bed size starting from 10 to 50, these charges would be almost ballpark, would be like that. So the important point is here is to have the intent from the leadership level, intent from the team level, intent to actually have a better care delivered to our patients. So if that is there, I think the affordability is never an issue. And at the same time, to also stress about one point, as learner of quality from the consortium of accredited healthcare organizations, I have known that CAHO had been so assisting in terms of having the quality standards and the standards trained first, and to have it implemented and handhold toward the complete journey of quality accreditation. So my strong point here is it's completely affordable. If a smallest of the clinic wants to actually pursue quality, that would help their return on investment. It is going to be a hugely returning on a long term if we really talk about quality journey. So therefore, please apply for accreditation and you will be definitely benefited out from here. Thank you.
Thank you, sir. Thanks for that motivation packed information that you provided to answer that question. Rightly said, it is the intent and not anything beyond that. If you have the intent to pursue it, the cost is not a matter, because as a hospital, we all do everything that is required to maintain quality on a daily basis. Just that we need to put it into an organized format, which NABH helps us to do that. So rightly said, if we have the intent, definitely it is affordable and it is doable, and it gives you an organized structure to run your institute. We have some more questions pouring in. Why is NABH important to a hospital? So, Rajan sir, if you can help us answer this question, that would be great, because you lead as an administrator. So you should know the challenges that can happen without NABH and how NABH can be helpful.
So far, we have been discussing various aspects of quality journey. And that is the most important thing. Why means very simple. You are a part and parcel of the society. And to be alive, to be functional in a qualitative manner, and NABH is the only actually available medium in India. I mean, a standard way, recognized by the government of India, recognized by various organizations and all those things. Now, coming to the little detailed part of it. Number one is legality. When a hospital is NABH accredited, it gives a baseline standard that the hospital complies with all required statutory norms. As I said it, when you have all the statutory norms, then only you can apply for accreditation. So that becomes a benchmark. Your statutory part is absolutely ready. Number two, NABH also ensures that regular revalidation or renewal of these statutory norms are taken care of, because there is a reassessment followed by, surveillance assessment followed by reassessment. It's a continuous process. And again, if you remember, Indubala madam had put it rightly that reassessment is altogether going to be a little more harder than the initial assessment. So there is always a journey through quality in a better way. So that is the most important. Then patient rights are protected. You will be having the proper documentation as required in a hospital. Whenever a patient asks for a document, or an insurance company asks for a document, you have all the data right from your what you call case sheet to the end, your TPR chart. So everything is in a systematic manner, and every aspect, again, if you talk about the case sheet, from presenting complaints to the discharge summary, there are a lot of things which is actually taken care of in the NABH chapter. So when you follow the chapter in a required manner, the patient care becomes easy, income generation becomes easy, and compliance to legal aspect becomes easy. And again, income generation in the sense you have a standard treatment protocol, things like that, where you have enough manpower. Utilization of manpower is also taken care of. Every aspect of function is taken care of in the entire 600 plus standard elements. So, and there is no other, reliable or reasonable or standard, for that matter, that input available to take the journey of quality ahead in the country. So that is NABH is the last word for that, and that is the best way to what you call select the route. I mean, I don't know if there is any other accreditation standard at par, or at least let's say 50% of NABH available in the country. So this is the best solution. Even a small hospital like Dr. Rejikumar sir has said, and there are a lot of avenues, like you have entry level small healthcare organization, one bedded Panchakarma clinic can very well apply for a standard. And what is not there, when a hospital start functioning or a clinic start functioning, you need to have a case sheet, you need to have a scope of services, you need to have a pharmacy running. So everything is taken care in the standards in a elaborate manner according to your need. If you are a small hospital, in a small way, little bigger way, biggest in the biggest way. So that is what is my take on the subject, why it is required. Very simple, I think.
Thanks for beautifully summarizing the benefits of NABH accreditation, sir. And as rightly said, along with this, also there can be some incentives, like there can be an empanelment with the Ayushman Bharat Yojana. There can be insurance empanelments. Other than all the benefits that sir has told, this can also be some of the other benefits that one can think about for going for an accreditation process. We have one more question, which is What are the challenges to be taken into account for a single doctor-run AYUSH clinic or consultation setup for a entry-level accreditation? Reggie sir, because you have a vast experience in the entry level and motivating the entry level accreditation process, yeah, I think it would be helpful if you can help us answer this question.
Yeah, actually, Dr. Swetha, this is a nice question because see, many times small hospitals, they are reluctant to go for entry-level certification or accreditation with this fear in mind. Yeah, I'm having a small facility. I am having only one doctor, and my paramedics are also limited. Should I go for an accreditation, or shall I actually apply for accreditation? That fear is there. But there is no point in this fear. See, if your quality system, basic quality system like documentation, what all things explained by Rajan sir earlier, is available, even with a single doctor, you can definitely go for accreditation or entry level certification. But bare minimum, like if you don't have the therapist or the person to do the procedures, person to give discuss the medicine, person to do your primary health care, then you can't have the bare minimum HR, then you can't go for accreditation. Otherwise, you are free to go for accreditation or certification, whatever the case.
Thank you, sir. Thanks for summing it up. We have one more question which sounds very interesting. It's someone who has given us a very good question. They want to understand how to attract talent and retain a talent in a healthcare organization, especially the staff who are already trained in NAPH process. How to attract them, retain them, and continue to have them in the institute. Thao sir, I think you might be a master in doing this throughout your career. So, would you help us answering this question, sir?
First, to attract and retain and motivate them to stay in the organization, to talk about the institution when follows the systems and processes and delivered the best of the quality services. That becomes the best attraction for employee to join an organization. So NABH accredited hospitals per se has those qualities embedded into the systems which by default would actually respect the individuality of the employees, respect their rights and their benefits within the organization. The legalities that Mr. Rajan has already mentioned would definitely be there. We have a very strong chapter within the NABH to talk about the human resource management, HRM. So within this is, I think, is the best way to really attract the newcomers which are coming out from the colleges for the first time. They would definitely look at the quality standardization of the institution where they want to join. And from the welfare perspective, if we actually adhere to the quality norms which are set by the NABH, we have a strong feeling there cannot be a no, or you would never be false short of manpower to join in your institution. Third is to maintain the quality. Again, this again coming back to the Bible of what I have in the NABH is CQE, continuous quality improvement. So there will be training programs. I've been brought up in the organization where the NABH was either commissioned or all the organizations were NABH accredited, where my training was taken care of. And I feel strongly up to the level of going to Indian School of Business, starting from the TTT in the quality journey, where we were taught into our departmental manuals and brought up with the trainings. This creates a lovely career pathway for anyone who embarks their career in an NABH hospital. So that is a strong point. I feel that every employee will be taken care of in an NABH hospital. So, saying so, the important point again draws down to how we lead the NABH accreditation and maintenance of the NABH standards to the core in the hospital, which should definitely bring in good results in terms of the handling the attritions, or to say retaining the best of the employees and continuing the quality journey. Thank you.
Thank you, Thao sir, for a detailed idea of how to retain the qualified staff and how to attract the qualified staff. We have one more question, which is quite interesting. It says, if a hospital has multiple departments like Ayurveda, yoga, naturopathy, physiotherapy, and also allopathy medicines, is there a need of separate accreditation for each system of medicine? Or is there an integrative NABH accreditation program? Rajan sir, if you can help us answer this question.
Yes, please. Thank you for the question. It's a genuine question because many places there we could find having allopathic medicines. Then in some places naturopathy with Ayurveda mixed and all. So as far as my knowledge goes, Ayush sector the whole, like Ayurveda, Unani, then all this can be combined. There is a standard also coming up. Madam has given us enlightenment in that line just before. So it can definitely have an Ayush accreditation in the long run. Now, as of now, I think Ayurveda standard gives more information about all these things, and there is a connection also, like what is done in Unani. Their what you call regimental therapy in Unani is Panchakarma therapy in Ayurveda. So more or less, there is a kind of compatibility. So that forms in one group. But if there is and physiotherapy as such is wherever depending upon the Unani can definitely have a physiotherapy, Ayurveda can definitely have a physiotherapy, or modern medicine, no problem. But when you say physiotherapy as a service, you need to employ a definitely qualified physiotherapist having a registration. So that is one thing. Then only you can, and it in Ayurveda, it is registered as karma abhyasa. In that, you must be knowing it. So it is coming under that category. So you need to register accordingly as part of, apply as part of scope of services, having the required required qualification. That is what about the physiotherapy in all Ayush hospitals. When it comes to running both the hospitals, like modern medicine and Ayush in one setup, definitely you need to have a different accreditation for modern medicine and different accreditation for Ayush, because the standard is different. The operational administration can be done up together, there is no issue, but clinical management is entirely different. So you need to have a different standard, and that has to be accredited according to allopathy hospital according to that standard. So that is, the hospital has to have. We have seen also many places having both the accreditation, like allopathy modern hospital accreditation and Ayush accreditation. So that is two different things, but generally you need not, like when you say billing can be done together, there is no problem. Security can be together, but clinical management as such is a different activity altogether. So there should be different standard, different SOPs, and different management, all those things. So, and definitely a different accreditation for that matter. I think this gives a concise idea about the whole requirement.
Thank you, sir. Thank you, sir. It gives an overall idea of what is possible and what needs a separate accreditation. Thank you for that answer, sir. We have one more question, which is not more about the accreditation, but somebody wants to ask, Shailaja wants to ask, can a person working as a quality manager in allopathic hospital work in Ayush hospital as quality manager? Yes, definitely they can work, provided they can get the understanding of the functioning processes in the AYUSH hospital, because the standards are more or less the same with a little more or less of objective elements, but it's more about the functional processes that one needs to upgrade themselves on. Then definitely that is possible. Hope that answers the question.
Definitely.
Thank you, sir. There's one more question which asks about what are the points one can keep in mind while constructing a hospital to comply with the quality standards. Any of the panelists who would want to comment on this?
If Thao sir is
Rajan
there,
sir,
I can, no problem. If Thao sir
Thao
wants,
sir or Rajan sir, if you want to take
Thao
this.
sir, because he's running too many centers, so definitely he'll be a better person. I can definitely contribute little later on.
Definitely,
Yeah, thank
definitely.
you,
Thao sir.
thank you, Rajan sir, for referring it to me. So when we generally build a hospital building for ourselves to stay at home, we talk about the safety. So when we talk about a building for a hospital, it is the same thing. Important point here, basically to understand, because patients would be staying there, they would be in a condition where when they are not mobile, they would be having similar level of problems, which could be at times very dangerous. With this history of hospitals in India, we have faced many incidences where we got the shortage of oxygen problem, sometimes fire problem. In Kolkata, date back in 2011, there's a huge fire in a hospital. So eventually hospital had to get locked by the statutory bodies. So the important point here, when we construct a hospital, we should look at those safety norms first. And from the statutory requirement, Rajan sir would definitely put more lights on it, is the fire certification process to be started for fire clearances, the pollution control, the occupancy certificate, consent to operate or to consent to establish. CTE and CTO are to be availed first as steps, and thereby constructing the hospital to keep a vision, not the number of beds, but the assurance of patients' safety onto it. So the essential elements today are added into have a ramp where a patient could be wheeled out from the hospital out in case of any emergencies or any disasters. So those are basic things, those have to be looked at. And from the statutory norms, there are laundry list of requirements which are supposed to be met. Importantly, the basic thing to look at: start a clinic, start a daycare center, start a small hospital. Let us look at the patient safety first. When you look at the patient safety first and design those facilities, I'm sure we definitely not face any.
Okay. ഞാൻ ബസ്സിനെ എടുത്തു വെച്ചിട്ടുണ്ട്, ഇപ്പൊ ബുക്ക് ചെയ്താൽ മതി. നിങ്ങൾ നോ പറഞ്ഞ 1 second.
Thank you.
There's some.
Yeah.
Yes, sir. Thao sir, please continue.
Yeah, that is it what I wanted to contribute. Probably other respected panelists could add into it.
Sir, any of the panelists would want to add up to this, answering this question?
Thao sir has well answered the question clearly. Just to add 2-3 things, the hospital is for patients. Simply put it. So every nook and corner of the hospital should be patient friendly. Then most importantly, access, and the NABH standard starts with access. So access to the room, access to the hospital, access to the patient care, wherever it is, it should be patient friendly, wheelchair accessible. That is the best terminology be used rather than compromising on terminology. So that is one thing, and all other thing depends on the size of your hospital. All other things, legal clearances and all those things, whatever be. Suppose if it is you are going to build a 3-story building, even if it is a 10-bedroom facility, if suppose it is a 3-bedroom, a 3-story building, lift is a natural requirement. And if it is not there, there should be a ramp. And if that is also not there, there should be a policy that you will admit only patients who can climb up. Other patient has to be admitted in the ground floor. So these all depends upon the size, your requirement, and put it in NABH part of the scope of services in total, I think.
Thank you, Tao sir and Rajan sir, for wonderfully answering this question. We have a similar question on the lines that we already answered. Somebody wants to know, we have a polyclinic facility with departments of homeopathy, Ayurveda, and dental clinic under the same name and same management. Do we have to apply for each department separately? I hope this question is already answered previously in terms of having integrated departments. So we have one more question here, a very interesting question. Somebody wants to know, please inform examples of key performance indicators for Panchakarma. Rajan sir, with your permission, can I take this question?
Definitely. Key performance indicators, right from your time. Let us put it in the perspective of 2-3 things. One is patient, other one is management, third is your staff, then the facility. All 4 the things you can have key performance indicators on all these things. It's a very wide subject. So why this key performance? To measure the performance of, you have your performance, your manpower, you have your performance of your facility, and all these things. Now coming in the narration part of it, what is timing? Whether your people come to the treatment room on time, whether they maintain the timing, 1 hour, if it is 1 hour, 35 minutes, if it is 35 minutes, whether they are maintaining. Next thing is the right patient, right limb, then right medicine, right time, all these things are to be measured. So you put it into this is a big thing which can be measured. Anything and everything can be measured. Then come to the income part of it, whether you are charging the right amount, and whatever the oil required is used, or is it more than that? There should be a check and balance for that. Number of people involved, and the timing. If it is 30 minutes and if the treatment is done for 45 minutes, it's going to be a loss. So all these are to be monitored, and all these things are key performance indicators. And in a minimum way, let us put it in another aspect, like Vyabats, Vasti Vyabat, then Virejana Vyabat, whatever Vyabat, that is also reactions, I mean to say, has to be measured if it is there. So measured or evaluated, then accounted for that matter. So these are the common thing which I can tell about. The key performance indicators is for every aspect of operation in a hospital, right from your patient satisfaction. That is another area where whether the patient was happy, that you can keep it in the room itself. From that, before leaving the patient writes their remarks in that. At the end of the treatment and completion of the treatment, you can have it done there only, or you can have a what you call QR code done. Then and there it is complied. So all these things are possible, measuring your quality. Quality of manpower, quality of your facility, quality of your what you call management time, competency of your staff, of your doctors, all can be measured through key performance indicators, and there is no end to it. It has to be designed according to your requirement and your facility. That's it, I think.
Thank you, sir. Rightly said. As sir told, there are infinite ways of doing a KPI for improving your services in Panchakarma procedures. But if you want to go by the rule book of NABH, there are about 63 KPIs, out of which few of them are directly attributed to the Panchakarma KPIs. So as sir told, those are the areas in which these KPIs come from, like whether you are doing any Vyapats, like Basti Vyapat, like Basti infection rate is one of the KPI, then burn incidence is one of the KPI, rescheduling of your treatment is one of the KPI. These are all the areas what sir has told. I'm just putting terms to that, what is given in NABH accreditation book. So there are also equipment downtime KPI, and also wrong site, wrong patient KPI. These are all the KPIs that are straightforward. Other than that, there is no limitation for documenting any KPI to improve your service. Hope this answers the question. We have one question which says, what is the patient safety measure that HCO needs to follow for accreditation process? Reggie sir, if you can help us in answering this question.
Yes, Dr. Swetha. The question was regarding the patient safety.
Yes, sir. Yes. What are the basic patient safety measure that a HCO needs to follow for accreditation process?
Yeah, basically the patient safety mechanisms that any institution should go for should be with respect to what Rajan sir was also just explaining. Hospitals are for patients. So whether patients, their immediate bystanders and their relatives, whether that environment is safe for them. So primarily, any hospital should go for patient safety in terms of construction, in terms of management. So if it is in terms of construction means like starting from the ramp or starting from the entrance of the institution, there should be a barrier-free access to each and every part of the institution. Second thing, with respect to the other possibilities of emergencies, like there can be fire emergency, there can be other natural disasters as well as man-made disasters. So whether there is a risk mitigation plan, like if at all there is a fire emergency, is there an option for mass evacuation? Is there an option for like assembly area, shifting the patient immediately from one area to another? That possibility is there. Now, with respect to other things like patient safety related to complications, like if there is a complication for the patient, is there a system for patient transport, emergency transport? Whether there is a system for basic level support or advanced level support, depending on the caseload they are managing. So all these will come under the patient safety things, including the facility management safety things. All these things are exclusively discussed under the FMS chapter under the NABH. So you can go and refer all these things. This is in a nutshell what we can share right now. Hope it's clear.
Thank you, sir, for summing up the patient safety very beautifully. Hope that answers the question. Keeping the time as a constraint, there are some more questions. We would directly answer those to the people who have raised those questions. I think more or less we have covered all the questions that has been directed to us. Once again, thanking all the panelists for your valuable time, and also for giving a very enriching and enlightening panel discussion.